would like to introduce myself. I'm Alvin Glasgold, founder of the Glasgold Group for Plastic Surgery. I'm a board-certified facial plastic surgeon, and I specialize in rhinoplasty. Today I'll speak about revision rhinoplasty. This is surgery to correct a previously unsuccessful rhinoplasty. Approximately a third of the rhinoplasties I perform fall in the category of revision rhinoplasty, so I have extensive experience with this procedure. Many patients have had multiple procedures, so in proceeding with additional surgery, we want to ensure that we can anticipate a high degree of success. The majority of problems encountered in revision rhinoplasty are related to various types of distortion of the nasal tip. Correction of these deformities occur by exposing and reshaping the cartilage structure, which may include rebuilding the tip with cartilage grafts, usually taken from the nasal septum. This is completed through an external rhinoplasty approach, which utilizes a small, almost invisible incision on the columella. In the following slides, we're going to examine some examples of postoperative complications or bad results that presented to our practice after primary rhinoplasty, which was performed elsewhere. We'll also show the corrected noses after revision surgery. The first photographs that we'll examine are two examples of what appear to be completely absent tip structure, resulting in what is commonly referred to as a parrot beak deformity. This is probably one of the most common undesirable results that I encounter after rhinoplasty. It's best demonstrated on the lateral view as shown in this photograph. As you can see, there is an excess visibility of the nostril, which is also not an aesthetically desirable result. The postoperative revision results are shown. In this photograph, the postoperative results are underneath the preoperative photos and show a nicely structured tip and less visibility to the nostrils. This is the second patient's postoperative results. These are shown on the right. Tip restructuring in both of these patients involved utilizing septal cartilage to form a new and appropriately shaped tip. I also corrected the excess nostril visibility and slightly reduced the profile. The second type of undesirable result are contour failures resulting in a bulbous tip. As you can see, the tip is rounded and not well defined in these first two patients. This patient demonstrates a significant contour abnormality at the tip. She has a pinched nose and a rounded, ill-defined tip. On the side view, we can see her hanging columella, which is an excessive downward projection of the columella, resulting in a rounding of the inferior portion of the nose, and again, excess nostril visibility. Now we will show before and after photos of the last three patients. The preoperative photo is on the left. The postoperative result after our revision is on the right. In this patient, the preoperative photo is on the left, and the result after I perform revision surgery again is shown on the right. And in the third patient, who had a pinched nose, hanging columella, and visible nostrils, I corrected these problems by reshaping the tip cartilage, utilizing cartilage grafts and removing some redundant scar tissue in the tip. Thus, I produced a more normal and pleasant tip structure in relation to the rest of the nose. In a third category, in which the supporting structure of the tip has been lost, the tip has dropped. It is now below the normal profile line, resulting in an underprojected tip and an unpleasant profile. On the right, we can see the results after our revision surgery, in which we utilize septal cartilage to augment and refine the nasal tip. These final photographs demonstrate a poor result due to excess projection. The first example is a patient who requested a revision rhinoplasty due to an overprojected tip performed elsewhere. What I mean by an overprojection is that the nasal tip is too far out from the face. You best see this on a lateral view. In addition, you may notice that a nose appears pinched at the tip, which is best appreciated in the front view. The second patient was also dissatisfied. Her original rhinoplasty resulted in a severe distortion of the nasal tip associated with overprojection of the tip. The result of revision surgery are shown in the photographs on the right. They are just a few examples of the many problems we encounter and correct. Correction of these deformities was performed with an external rhinoplasty approach as previously described, and these produced a significantly more normal appearing tip as well as improved aesthetic balance between the tip and the remainder of the nose. We wish to produce normal looking noses. In my career, I have personally performed over 7,000 rhinoplasty. A significant number of these are revisions. From this extensive experience, I have realized the challenges and the technical difficulties in converting a bad result into a very good result. If you are considering rhinoplasty, or especially revision rhinoplasty, I recommend that you seek a board-certified facial plastic surgeon who focuses on rhinoplasty and has extensive experience in revision rhinoplasty. It's important that you feel comfortable with a surgeon and that at consultation he can answer all your questions and that he is able to demonstrate his expertise in revision rhinoplasty with appropriate before and after photographs such as I have shown. For more information, please visit our website at www.glasgold.com. Thank you for your attention.